Okay, so regarding of polarization of macrophage, we have two phenotypes of macrophage, M1 macrophage and M2 macrophage, and this is important also in the cancer. There are differences in the functions of M1 versus M2. The function of M1, it's a pro-inflammatory activity and also microbial and tumoral activity and tissue damage. While M2, it's anti-inflammatory or it has anti-inflammatory activity, phagocytosis capacity, tissue regeneration and repair, and also angiogenesis. And this is important also in the cancer. The term angiogenesis, we will cover it in more details later on. And also immunomodulation, in addition to tumor formation and progression. So M1 versus M2 macrophage. The polarization M1, as I said, it's a pro-inflammatory response to infection, while M2 it's anti-inflammatory and in tissue repair. The balance is very critical. So it's critical for immune regulation to have a balance between M1 and M2, and imbalance can lead to disease like sepsis. So persons affected with sepsis, uh, it's bacteremia with complications. Can be due to imbalance between M1 and M2. Regarding the tissue-specific macrophage, depending on the site of differentiation of monocyte to macrophage, we have different name of macrophage. Just as example, for example, in the bone, osteoclast, which the opposite of prosteoblast. Okay, osteoblast build the bone, while osteoclast has the opposite role. So osteoclast, it's a macrophage. And also we have another example like Kupffer cells. It's also macrophage, but in the liver. Alveolar macrophage, as the name indicated, it's also macrophage. So depending on the site, we have different phenotypes of different shape or different name of macrophage. Monocyte macrophage in disease. Of course, we can see the role of monocytes and macrophage in the inflammation, in the autoimmune disease, in the chronic inflammation, in the degenerative condition like osteoarthritis, okay, like Alzheimer disease, Parkinson disease, macular degeneration. We can use the monocyte and macrophage as therapeutic potential. For example, targeting macrophage as modulation or modulating macrophage polarization. So we can work on the polarization M1 versus M2 and functions offer potential for therapies in autoimmune disease and also in the infections and cancer. So